Hello and welcome. My name is Dr. Rizwan Qureshi, and this particular video is based on quite a few questions from doctors who no longer want to work in medicine or in a hospital or in a clinic in medium to long term or even short term because they've not been able to find a job. And I have come across a number of different examples of people working in different professions to enable them to earn a very reasonable salary. In this video, I will walk you through 10 high-paying non-doctor careers that are perfectly suited for international medical graduates. In terms of keeping it relevant, I'll divide this video eligibility, what this course involves, how much is the cost of this course, what are the kind of salaries that you'd expect after you've been offered a job on the completion of the course, and whether this course is really useful in terms of getting you a permanent residency. Let's dissect Clinical Research Associate. Now, eligibility, you can apply directly for graduate diploma courses or short courses through University of New South Wales, UTS, Monash. Some of these roles are even open to MBBS doctors without any new degrees. The cost of these courses could be between $5,000 to $10,000. And the salary that you expect after being offered a job could be between $80,000 to $120,000. That is an annual salary pre-tax. Now, in terms of its PR potential, usually it requires a job offer with a sponsor. So you need to have tier 2 visa options. Now, it has got a very good demand because, it is the kind of job which is in research, and there's always a lot of potential for the major research when they're conducted. They're looking for their assistants and associate. So there are many jobs when I was looking for it on Seek and LinkedIn job profiles. Number 2, Medical Science Liaison. The eligibility often open to the MBBS degree holders, and if you've got strong communication and pharmaceutical knowledge, this would be a particularly useful course for you. Now, it does not really cost all that much, but your background is very important. As I said, you need to be a doctor, you need to have a pharmaceutical or health business related industry background so that you can really take up this role of working as a medical sciences liaison. Now, these could be the jobs which are particularly suitable for people who like to travel, promote different products or promote different drugs, something which you'd call drug rep in Australia. The salary is actually quite good. It could range between $100,000 to $150,000. Now, in terms of PR pathways, it requires a job offer and it also requires sponsorship from the employer. Now, demand is actually not that great because it's mostly congregated to big or capital cities like Sydney, Melbourne, Brisbane, or Perth. But with the increasing health technology, there might be some niche demand in certain areas. Number 3, Health Informatics Specialist. Now, this is a very new coming field, and it is open to people who are, MBBS, and they can do some short courses in health informatics. And now these courses are available in Deakin University or UTS, and there are even an online program. For example, HL7 certification. Now, these courses would obviously cost you anywhere between $3,000 to $7,000, but the salary after that could be even up to $130,000. And yes, it does offer a PR pathway on the completion of the course and after having a job offer, because the jobs linked to this profession or degree qualification are medium long-term skilled occupation list, the list which is also known as MLTSSL. And the demand is particularly high in healthcare IT. We've seen a lot of boom with telehealth platforms and new and novel way of actually bringing a better quality health to people who are located in far regional and rural areas. So this sector is particularly booming. Medical writers. Now, obviously you need to have an MBBS, which is usually sufficient, but you need to have a very strong portfolio, which means that you have to demonstrate that you've done some scientific writing, you've done some editing on the short courses, or you've really come up with a very creative blog of some sort, which is related to a social media marketing or even some sort of business venture or startup. Now, you can do courses to really optimize your learning in this category, and these courses could be quite cheap, between $2,000 to $5,000. But if you're working for a large company looking after their medical write-ups, then the salaries could be as much between $70,000 to $110,000. And the beauty of this, that after the completion of the course, you can work remotely. Now, in terms of PR pathways, it does require a job offer, and unless and until you're doing a freelance work, you would need a visa. And I feel that this is an area which is particularly affected by AI, and now AI is able to do lots of generation of work in terms of medical write-up. However, there's always a demand for the right person with the right aptitude and the right skill set. So if you have someone who's really developed a tech platform, who's really shown a category of work which has got niche audience, then demand is growing. And as I said, remote options are available. Now, health administrator. You can apply for health administrator programs through Master of Health Administration or MHA, or graduate diploma courses through La Trobe, UTS or ACU. Now MBBS is an eligible base degree. Now the cost of these courses could be quite high. It can be between $20,000 to $35,000, and the course duration may vary between 1 to 2 years. However, once you get a job offer, the salary could be anywhere between $80,000 to $120,000. And yes, it does have a good PR potential with job in regional areas or employed sponsorship areas in the regional towns, or even some urban or semi-urban towns. Now demand has been consistently there, especially in public sector. So if you feel that you like to work in a medical administration, working in a large hospital, especially in regional hospital, you're good in terms of your communication skills, you're good at paperwork and organizing all the documents, and this might be the job for you. Public health officer. Now you might be eligible to apply for Master of Public Health program, which is offered in all major universities. And I do come across lots of doctors who have come through, Bangladesh and India, who've primarily done MPH or Masters of Public Health whilst they were looking for a doctor job. If you are looking for a doctor job, then MPH might be wasting time, because this duration of course would be counted as a gap. So it becomes really difficult to justify that. But as I said, this video is primarily focused towards doing these courses, finding a job in these sectors for a medium to long term or permanent job in that area. So as I said, MBBS is a direct eligibility. Now cost of these courses could be very high, often between $20,000 to $40,000, but the salary is quite good, between $85,000 to $90,000 to up to $120,000. And yes, there is a good PR potential if the job is secured. Genetic counselor. In order to be eligible for genetic counselor position, you need to apply for a Masters of Genetic Counseling. It's a 2-year program which is offered through Monash or University of Melbourne. MBBS is acceptable for entry level, but the cost of this course is quite exorbitant. It may cost you between $30,000 to $50,000. The salary after the job offer could be between $90,000 to $110,000. And yes, it has got a good strong PR potential, and it is on skilled migration list. But do check out the skilled migration list by yourself, because this list is quite dynamic. Medical laboratory scientist. You need to have a Bachelor of Medical Laboratory Science or obviously a medical degree. There are fast track conversion programs which do exist for MBBS graduates. Now cost is actually again quite high, $25,000 to $40,000, and the salary after the completion of course and a job offer could be between $70,000 to $100,000. They are linked to some of the PR pathways because they are on skilled occupation list, and the demand has been consistent, especially in the public and private labs. So if you are someone who would like to work in a laboratory, facilitate the histopathology, pathology, hematology or clinical biochemistry, or just work in a hospital but away from the patient, that this might be a profession for you. Now, transplant coordinator. In terms of eligibility to being a transplant coordinator, you need to have MBBS degree or a nursing or health administrative experience. The courses are available by various training providers, and it's not really very expensive. The course could be between $5,000 to $10,000, and the salary could range between $80,000 to $130,000 Australian dollars. And in terms of its PR potential, it usually requires a job offer, and it does require sponsor, but it is quite a niche specialty. And the good thing about transplant coordinator, that their job seems to be focused in a major hospital, because that's where the transplant teams are. So you'd be looking for jobs in capital cities like Sydney, Perth, Melbourne, Brisbane, or any other major tertiary level teaching hospital where the transplant work is done. This job would be particularly suitable for someone who has got good communication skills. They are good at prioritizing work, and obviously they have got a very good form of connection when it comes to talking to the patient, the families, and also talking to the doctors to coordinate the entire effort of transplant. So again, something if you'd like to remain on the periphery of the hospital or even in the hospital to facilitate these discussions, this would be one for you. Now, health educator. In terms of eligibility, you can enter into this field via health promotion courses like MPH or often other health educator courses. Now, MBBS is often seen as a good strength when it comes to health educators. The cost of these courses are not quite expensive. They could be between $3,000 to $10,000. And the salary after completion of health educator course could be ranging between 60,000 to 90,000 Australian dollars. And in terms of PR potential, yes, if you have got an employment offer which is full-time and you're working in a community health or a public sector, then the demand is actually quite high in rural and community areas. How to apply for these degrees as doctor from Pakistan or India? Choose CRICOS, that is CRICOS registered courses. Now use your MBBS transcript and degree to apply for admission in those particular university. You may have to check it out on their website. When is the particular course going to start? What are the particular and specific requirement for that course? Now you're likely to receive a 485 graduate visa once you're accepted onto a course. You need to be very careful when selecting a particular visa which has been offered as a student visa, and you need to find that particular fit for you. Now looking for a course in regional universities is actually quite good, because some of these regional universities, they do add additional points when it comes to permanent residency. Now, does a degree guarantee a permanent residency? No, the permanent residency is not automatic or guaranteed, but it becomes much easier, especially if your occupation is on the MLT SSL list or regional list. And if you're working full-time after graduation, and then you're getting a job offer, which is a permanent job offer, then it really helps boost up your case. And if you're studying in regional areas, it also adds 5 to 10 points for permanent residency. It's a very good option for especially female doctors who like to look after the family. There is a life beyond AMC, whether you're between exams or considering alternate careers, or you're simply exploring your options and would like to really not be bothered with hospital work, clinic, patients, rosters, then this might be something that you'd like to really consider. To explore wisely, my suggestion would be to go and visit the immigration website, especially the skills occupation shortage list. See what of these occupations that I've already mentioned are on that list, and once you find those occupations, then try the appropriate courses. Some of these courses, as I said, will get you a student visa, and then if there's a good job potential after completion of these courses, then these courses, and on the completion of these courses, you'll get a job offer, and then you can apply for a permanent residency. It's nothing automatic that you do a course and then you'll land a job in your lap. It will be that you've completed a course, you've done an internship, you've really optimized yourself, you've got good communication skills, and then obviously if you get a job offer, you will be on the right and correct pathway. Most of these positions are permanent, and if you are really enjoying your work, you've got good communication skills, and really like that 9 to 5 work-life balance, then this might be something for you. Look after yourself and each other, and I'll catch you up in the next video. Goodbye.